Welcome. In this video, we're going to talk about a condition called dandruff or seborrheic dermatitis, which is the fancy medical term for it, that can affect your scalp, your face, your ears, and sometimes your chest, and I usually see that on guys. If we haven't met, my name is Beth, and I'm a dermatology physician assistant with over 20 years of experience in dermatology. Before that, I was a registered nurse for 10 years. So I've been in the medical field a long time. So I wanted to talk about different topics, and today we're going to talk about that nasty, flaky, itchy condition. We're going to talk about at-home treatments and also prescription treatments, but we're going to use two stories about two different patients. They're theoretical, but they should make it more interesting than just listing different ingredients that you can look for in medications. And we're going to talk about what happened with them and what they used to get better. And there will be a surprising possible cure for this condition at the end of the video. To start, let me tell you that if you have some seborrheic dermatitis on your face, you'll usually see it in the folds right here and in between your eyebrows. So it's the T-zone of your face. If you have some on your face, it is beneficial to treat your scalp, even if you don't think you have any on your scalp. And it is also beneficial to rotate treatments. It is also important to realize that stress will make this condition worse. And if someone has a neurological condition, such as a stroke or Parkinson's disease, they are more likely to have seborrheic dermatitis. They believe that this is an overgrowth of Malassezia furfur, which is a fancy name for a yeast that normally lives on your skin, but this yeast will normally break down oils and it can get overwhelmed, breaking them down, and you can get an inflammatory response, and they can't break down the oils anymore, and the skin cells build up and you get flaking. For our first theoretical patient, his name is Mike, and he's a trombone player with the New Earth Symphony. I made that symphony up. He does like a certain French horn player, but he is afraid to talk to her because his scalp constantly flakes on his black tuxedo or black shirts that he's wearing. They're going on tour soon, so he is really wanting to get it under control before they leave in a month for this world tour. His face gets red and flaky, and he wants to scratch his ears and his scalp during the songs. He can't be playing his trombone and scratching at the same time. So we need to get Mike better and fast. Our next theoretical patient is Millie. She is the mother of two young boys. No stress there, right? And she wants to have another baby, but she wants to control her itching and flaking before she has another baby, and she wants to do it as naturally as possible. She is very embarrassed by the flaking. Since the practice of medicine is an art and a science, I like to talk to the patients about the different options, and then we have a discussion about what they want to go ahead and try. So for Mike, we're going to talk about the different over-the-counter, at-home shampoo ingredients you can get at the store. You can get them on Amazon or in most grocery stores and drugstores. So for the first ingredient, we're going to talk about salicylic acid. It's actually a beta hydroxy acid, and it's made naturally from plants such as willow bark and wintergreen. Now, salicylic acid does a lot of things, like dissolving oil plugs. It inhibits oil from the oil glands, removes the outer layers of skin. It's anti-inflammatory, so it reduces redness. It's a chemical exfoliator, and it increases moisture in the skin. There are a lot of acne creams have salicylic acid in them that are easy to get. CeraVe has their CeraVe SA, stands for salicylic acid cleanser, and their lotion. They also have a CeraVe acne control gel that has salicylic acid in it too. So that's very easy to get. So you've got cleansers, there are shampoos with salicylic acid in them. So that's a good option. Another one is zinc pyrithione, and zinc pyrithione does kill yeast. It kills the M. and that thereby reducing redness and inflammation. So zinc pyrithione is made from a synthetic analog of aspergillic acid, which is an antibiotic produced by the Aspergillus flavus organism. So zinc pyrithione is in a lot of different shampoos. It's a DHS zinc shampoo, for instance, which you can get on Amazon. Head and Shoulders has their shampoo that has zinc in it. Another option would be ketoconazole 1% shampoo, which is the name brand Nizoral shampoo. Now, ketoconazole kills yeast and has anti-inflammatory properties similar to steroid therapy without being a steroid, which is pretty cool. It is a synthetic medication, however, and it disrupts the cell membranes of the yeast, and it first became available in 1981. So there is a prescription strength of that one, and I will talk to him about that in a second. So selenium sulfide is the fourth over-the-counter ingredient I would talk about for the over-the-counter shampoos and topical creams. Selenium sulfide, you know, is in Selsun Blue. It slows the growth of yeast. It slows down shedding of the dead skin cells, but it can cause skin irritation and hair discoloration and temporary hair loss. So you want to make sure it's rinsed out really well. So those are the 4 different ingredients. And so Mike's thinking about it. It's like, well, I think I'll try the salicylic acid. I'll start with that. He's going to start with that in a cream and a shampoo. And we're going to see him back really soon because we want to make sure he gets better before his trip starts. So we're seeing Mike back, and he's not quite where we want to be yet. He's not completely clear. He's still having some redness, still having some flaking, but he is somewhat better. So we are going to talk about going to a 2% ketoconazole shampoo, but that can be drying on your hair. So the other antifungal prescription shampoo is called cyclopirox shampoo, and it also comes in a cream. So that is also a synthetic antifungal and also has anti-inflammatory properties. But it can change light-colored hair. I guess that's a rare side effect. I have not seen it personally in anybody, but it can theoretically change light-colored hair to a different color. I'm not sure which color, but that might not be some risk that he wants to take since his hair is lighter. So that's cyclopirox shampoo or cream. The cream would be a good option, though. Another thing we might want to do is we might want to go with a week of oral antifungal pills. So the pills we would want to do would be the oral fluconazole pills. Fluconazole is often used for female yeast infections and also for valley fever. If you live in the United States in the Southwest, you're probably familiar with valley fever. And people sometimes have to take it for an entire year every single day. So it has been used extensively, and that would be a good option to get him better really fast. So I'm thinking probably use the cyclopirox cream for his face and ears and chest, and then go with the oral fluconazole just to get him better really fast. And then he can take the other things on his trip with him. The reason we wouldn't do oral ketoconazole is that it can hurt your liver, and it has been pulled from the European countries and Australia in 2013. And the United States put severe restrictions on prescribing it, but we would not want to go with oral ketoconazole. But the shampoo, the 2% shampoo would be okay, but there again, it could be drying. So that is Mike's situation. We see him back right before he goes on his trip, and he's doing great. So he's going to switch to some of the over-the-counter topical things after he's done with the pills. So that's Mike's case. Next, we move on to what happened to Millie. Hey, I almost forgot to tell you about an ingredient called sulfur that does help with seborrheic dermatitis. It comes in a cream, a lotion, an ointment, and a bar soap form. You can get it over the counter without a prescription, and it's a keratolytic. That means it removes the outer layers of the skin. It also has antifungal and antibacterial properties. So that's a good one. You can combine it with other ingredients to make it more effective, but it can cause dryness or skin irritation. So depending on which particular product you're using, it may or may not be a little drying. Okay, for Millie, this is where it gets very interesting, and basically we're leaving the traditional Western medicine field and looking at some other options that include food items. So I was actually surprised to learn that MCT oil kills yeast. And MCT stands for medium chain triglycerides, which are fatty acids with a carbon length of 6 to 12 carbon atoms. That's what makes them medium. And coconut oil and palm kernel oil are both MCTs. So you can take 2 teaspoons of olive oil and mix with a half a teaspoon of coconut oil, rub it into your scalp before bed. It's going to be a big mess. You're probably going to want to use a shower cap maybe, or put a plastic garbage bag over your pillow, or use a pillowcase you don't care about or a pillow you don't care about. And then shampoo it out in the morning. So that is a very, very natural thing to do for this condition. Another thing you can do is take 1 teaspoon of kimchi juice and mix it with 1 cup of water. That's 1 teaspoon of kimchi juice and 1 cup of water. And you rub it into your scalp, let it sit for 15 minutes after you shampoo it, and then rinse it out. So let it sit on there for 15 minutes and then rinse it out really well. So both of those recipes I found from some other doctors on the internet that are talking about more natural ways to treat seborrheic dermatitis. So I'm giving a shout out to Dr. Eric Berg and to Dr. Ken Berry. So both of those doctors are talking about natural ways to treat seborrheic dermatitis and even cure seborrheic dermatitis. Also, another product that has natural ingredients in them that Millie could use would be something called Derm Gentle Sebderm Scalp Seborrheic Dermatitis Scalp Serum. So it's a big long name, Derm Gentle Seborrheic Dermatitis Scalp Serum. And that has 3 main ingredients that work on the seborrheic dermatitis. Xylitol, which you know as a sweetener for a sugar substitute, but it neutralizes the yeast biofilm and makes the yeast vulnerable to treatment with antifungals. And dentists will actually recommend a xylitol gum to be chewed after your meals to help with killing organisms and bacteria in your mouth. So this is for making the yeast biofilm vulnerable. The second thing is the MCT, which also, as you know, reduces the yeast after the biofilm is weakened, so it helps it work even better. And then the squalene is a moisturizer to repair the skin barrier, and it doesn't feed the yeast. Certain things can feed the yeast, and this one doesn't. So Derm Gentle would be a very good option. I believe it's only available from their website though, so that is one of the downsides to getting Derm Gentle Seborrheic Dermatitis Scalp Serum, which I assume you could probably use on your face as well. See how I don't know how oily it is. Next we're going to look at another option for Millie, and at the very end talk about dietary options, which some doctors claim can completely cure seborrheic dermatitis. Stay tuned. I also wanted to tell you that ketoconazole 2% shampoo is red, and it's the prescription form, and it can make white hair a bit pinkish. So if you have really white hair, that may be a problem for you if you don't want pink hair. But if you've been using it for years and it hasn't caused pink hair yet, then great. Okay, for our last recommended product, we go to something called Royce Derm. And this one is available on Amazon, so it is easier to get than the Derm Gentle. So the Royce Derm has a blend of herbal extracts, 6 different herbal extracts that I would butcher the name of them. If I tried to say them right now, I'm not a botanist, okay? But those herbal extracts have antifungal properties. It also has salicylic acid listed as the active ingredient because I think they aren't supposed to say that the herbal extracts are the active ingredient, but I think those are the big difference in this product is those herbs, okay? Those herbal extracts decrease inflammation, they decrease itching, redness, and flaking. They soothe and balance the scalp microbiome, which are all pretty awesome things. It's sensitive for sensitive scalps too, which is a big plus. They also have a shampoo and a cream, and they also have a conditioner. But for this condition, really, we're treating the scalp. We're not treating the hair itself, so you wouldn't really need the conditioner, but you could get it if you wanted to. Okay, so we see Millie, and she decides she's going to do the olive oil and the coconut oil because it's easier than getting the kimchi juice to stay in her hair. So she does that. And she wants to also use the Royce Derm product, which, by the way, I have had a patient with psoriasis who used the Royce Derm and it worked fantastically, which was the first time I had heard of that product. So I do have experience with that one. So Millie wants to use those products. They work fantastic. And she is thrilled to try and have another baby. So, great ending to our theoretical patients. Both of them doing really well. Okay, let's talk about the most exciting thing is the possibility of completely curing seborrheic dermatitis. You won't hear that from the traditional dermatologist, but there are some doctors on the internet saying that if you do certain things with your diet, you can completely cure it. They are these basic 2 things. One of them is eliminating your non-veggie carbs, which would be potatoes, rice, bread, pasta, that sort of thing, because they turn into sugar and then sugar will increase inflammation in your body. The second thing is to cut out your seed oils or your industrial seed oils as they're called, and they are typically omega-6s and 9s, fatty acids. And when those 6s and 9s that your yeast is trying really hard to break down, and you're taking a bunch of it internally, and you overwhelm your system, and the yeast can't handle it anymore, and increase that inflammatory response. So they're in a lot of processed foods. So the other thing would be to reduce your processed food consumption. So there is the diet component that can possibly cure your seborrheic dermatitis. There are 2 doctors that have great videos on this, Dr. Eric Berg, B-E-R-G, and Dr. Ken Berry, B-E-R-R-Y, and you can go look at their videos on this topic and see if you want to give it a try. And if you want extra help with the itch, I did make a video about itch relieving ingredients, and I will definitely link that at the end of this video. Well, I hope I've provided some benefit and some value for you today. I wanted to take some Western medicine and meet some alternative, non-traditional ideas and bring you something new and fresh for dermatology tips. Till next time.